Hello, thank you for joining us today. We're going to go through the introductory course to monkeypox prevention and control. My name is Dr. Rosamund Lewis. I'm the head of the Smallpox Secretariat at the World Health Organization in Geneva.
And I'm Nikola Sklanowska, and I'm a consultant at the World Health Organization.
This module will walk us through several aspects of monkeypox prevention and control. What is this illness? How did it emerge? What are the routes of transmission? What does it look like? How can we distinguish it from other illnesses with rash and fever? We're going to discuss prevention and control strategies, and we're also going to look at laboratory diagnostics.
So in the next couple of slides, I'm going to introduce you monkeypox, what causes it, where we can find it, and what animals can transmit it. The illness is characterized by severe rash, fever, and swollen lymph nodes. The illness can range from being self-limiting to very severe. In some cases, it can also result to death in up to 11%. Most deaths occur in young children. So monkeypox occurs primarily around rainforests of West and Central Africa. The natural hosts, or maybe hosts, are not known, but there are various animal species which are known to be susceptible to the virus. Variola virus, which is a virus related to monkeypox virus and caused disease known smallpox, was eradicated in 1980, and after this eradication, monkeypox emerged as the most significant orthopox virus in humans. So I already mentioned variola virus and monkeypox virus, but there are also other viruses which belong to the same genus of orthopox virus. These are, for example, cowpox virus or camelpox. Monkeypox is a viral zoonosis, as we like to call it, which means that the disease is transmitted from animals to humans. The symptoms of monkeypox are similar to the ones of smallpox, although they are less severe. I already mentioned that smallpox was eradicated in 1980, and during this eradication, the vaccine which was used was also partially effective against other orthopox viruses like monkeypox. So after the smallpox was eradicated and the vaccination was stopped, the unvaccinated population became also more vulnerable to other orthopox viruses, including monkeypox. There are two distinct genetic subtypes of monkeypox virus, the West African clade and the Central African clade. So the Central African clade of the virus is found in countries of Central Africa, for example, the Democratic Republic of the Congo, the Republic of Congo, Central African Republic, and other. Clinically, this virus causes more severe infection and is more transmissible. On the other hand, the West African clade of the virus is found in countries of West Africa, for example, Nigeria, Sierra Leone, and Liberia. This clade of the virus usually causes less severe illness and is less transmissible. Monkeypox was first identified in monkeys in 1958 and was later also found in rodents. First case of monkeypox in humans was identified in the Democratic Republic of the Congo in 1970. The DRC also now reports the highest number of suspected monkeypox cases, more than 1,000 a year. So the DRC was the country where we saw monkeypox in humans for the first time, but soon after, other countries of Central and West Africa also reported confirmed cases. Since 2016, for example, Central African Republic, the DRC, Liberia, Nigeria, the Republic of Congo, and Sierra Leone all reported confirmed cases. Additionally, the virus was also exported outside of the African continent multiple times. For the first time, through infected rodents to the United States in 2003, where it caused an outbreak in humans. Later, in 2018 and 2019, we have seen exported cases from Nigeria to Singapore, Israel, and the United Kingdom. In the case of United Kingdom, the disease was exported through 3 independent travelers. Monkeypox is mainly transmitted to humans from animals, including rodents and monkeys. Infection can result from direct contact with body fluids, including blood, and external lesions of the infected animals. Another route of transmission is when someone is eating inadequately cooked meat of infected animals, which is a possible risk factor. Therefore, it is important to fully cook all meats and any other animal products before consumption. For most human infections, however, the source is not known. Various animal species have been identified to be susceptible to monkeypox virus, and this was determined through laboratory experiments, outbreaks among captive animals, and also field investigations. And now Rosamund is going to talk about the human-to-human transmission, and she will also walk you through the clinical aspects of monkeypox.
Now that we've heard about the animals that carry the monkeypox virus, let's talk about person-to-person transmission. This same virus can be transmitted from one person to another through close contact with infected respiratory droplets, such as, for example, when somebody coughs or when somebody sneezes. It can also be transmitted by direct contact with the rash on the skin, the pustules, for example. And also, the virus can survive on contaminated objects. Of course, with this close contact, the people most at risk are healthcare workers and members of the household of the patient. They are both at higher risk of infection. However, despite this risk, we know that person-to-person transmission of monkeypox is relatively limited compared to some other infectious diseases, and most outbreaks consist of only a few cases within families. Once a person has been infected with the virus, there follows the incubation period. This is the period from the moment of infection until the onset of symptoms of some kind, fever, rash, for example. So that incubation period in humans is usually 6 to 13 days. However, it can range from as little as 5 days and to as long as 21 days, which is the period we use if we're monitoring an outbreak. The course of the disease can take several weeks. So first, following the incubation period, there's something called the invasion period. This can last up to 5 days, and it is characterized by fever, intense headache, swelling of lymph nodes, back pain, muscle aches, and an intense weakness or lack of energy. Once the rash appears, which happens about 1 to 3 days after the beginning of fever, then it appears in stages, beginning on the face and spreading to the body and limbs. This rash is very characteristic. You might recall smallpox. The rash of monkeypox looks very much like smallpox. It starts with what we call macules, which are flat lesions, red, usually reddish, to papules, which are kind of raised, firm lesions, and then those evolve into vesicles, which have fluid in them, and finally to pustules, which actually have pus. These pustules then crust, they dry off, you could call them scabs, and this whole evolution can take several weeks. The rash will initially affect the face in 95% of cases. Characteristic of monkeypox is the fact that it affects the palms and the soles of the feet. This is in 3/4 of patients, and it's unusual because most infectious diseases don't do that. It will affect also the mouth, the eyes, the genitalia, and all of these areas of the body can result in complications when they become infected with monkeypox. It will take several weeks, 3 weeks, maybe even 4 weeks, for the whole rash to evolve, dry off, and then disappear. Once a rash develops, it can remain quite mild, or it can evolve to several thousand painful lesions. Accompanying this rash are swollen lymph nodes. This is quite a distinctive feature of monkeypox, and it's very important. It starts before the rash, usually, which means it's a harbinger of the disease. But also, it distinguishes monkeypox from smallpox, which of course doesn't exist anymore. But smallpox did not have this characteristic feature of swollen lymph nodes. As we've said, the whole course of monkeypox can last 3 to 4 weeks. Severe illness occurs most commonly in children, and as mentioned, up to 1/10 of patients can die. So how do we distinguish monkeypox from other common childhood infections? The ones that are most important to identify are chickenpox, which is not even a pox virus, it's a herpes virus, but it causes similar blister-like lesions. Measles is unfortunately still too common because the vaccination programs are not yet reaching all children. Other conditions to be ruled out include bacterial skin infections, scabies, syphilis, and some medication-associated allergies. As the illness usually starts with fever before the rash appears, of course, other conditions to consider include other febrile illnesses. Laboratory confirmation is usually necessary to make a definitive diagnosis of monkeypox because of the similarities between different rash and fever illnesses. This table highlights some of the distinguishing features between these relatively common infectious illnesses. As we've said before, fever usually starts first. It's the same for monkeypox, chickenpox, and measles. The duration of the fever may vary slightly by a day or two. The rash appearance is most distinctive. As we've said, measles appears as a flat rash, chickenpox appears as little vesicles, and monkeypox evolves through all those stages to scabs. However, there's something else about the rash that can help us distinguish between these conditions. In monkeypox, all lesions on one side of the body tend to be at the same stage of evolution. In chickenpox, you can have eruptions of vesicles at different parts of the body at different times. It's similar to measles. You can have the rash in different stages at different times. The distribution of the rash tends to be more dense on the face in monkeypox and on the hands and feet. As mentioned before, it also appears on the palms and soles. This is usually absent when it comes to chickenpox, which has a rash much more dense on the body. Measles starts on the face and spreads downwards and sometimes reaches the hands and feet, but not always. As mentioned before, swollen lymph nodes are pathognomonic for monkeypox, although we do occasionally see swollen lymph nodes in measles as well. As we've seen, monkeypox is very similar to the way smallpox presented up to 40 years ago when it was eradicated. Thankfully, we don't have smallpox anymore, particularly as it did kill up to a third of patients. Monkeypox, however, can still lead to death in up to a tenth of patients. Now let's turn back to Nikki, who's going to walk us through laboratory diagnosis for monkeypox, as well as infection prevention and control.
As you just saw, monkeypox can be confused with other fever and rash diseases, and therefore laboratory confirmation is crucial. The best diagnostic specimen for monkeypox is directly from rash. So the rash fluid, the lesion roof or the crust, because all these are full of viral particles. The preferred diagnostic test is to detect the viral DNA by polymerase chain reaction, PCR in short, given its accuracy and sensitivity. Antigen and antibody detection methods are not preferred for diagnosis because they cannot differentiate between different orthopox viruses. All specimens from humans or animals which are suspected to contain monkeypox are possibly infectious and therefore need to be handled only by trained staff wearing appropriate personal protective equipment. The samples should be stored safely, packaged in triple packaging and prepared for transportation according to the WHO guidance on transportation of infectious substances of category A. Standard contact and droplet precautions are key to minimize spread of infection. All healthcare workers caring for patients with suspected monkeypox and handling their specimens should follow these precautions. Wash hands before and after caring for a patient, touching surroundings or handling specimens. Wear appropriate personal protective equipment, which in this case includes gown, gloves, surgical mask, and goggles. Ensure proper isolation of a patient. Ensure appropriate waste disposal and environmental decontamination. And ensure safe and dignified burials. Implementing the mentioned infection prevention and control measures are crucial in any setting. Persons taking care of and suspected monkeypox patients, including household members, should follow these precautions. Avoid close physical contact. Wear gloves and other personal protective equipment. Always wash hands before and after caring for and visiting sick persons. And now Rosamund is going to continue with prevention and treatment.
Okay, let's talk about prevention and treatment of monkeypox. This is a fascinating area. First of all, in order to offer the best care for patients with monkeypox, we need to look after the whole patient. The child may be in pain because of sores in the mouth. That may lead to the child not wanting to eat or drink. This may lead to dehydration. The child may have vomiting or diarrhea. So what we offer patients with monkeypox, children or adults, is supportive care, fluids, rehydration, liquids, as well as pain control. We may also need to offer some antibiotics for prevention or treatment of infections. The question often comes up as to whether there's a vaccine for monkeypox. If you had asked me that question just a month or two ago, the answer would have been no. But in fact, there's been a lot of research done to develop safer vaccines for smallpox. Because the viruses are so similar between smallpox and monkeypox, in fact, these vaccines have already been shown to also be effective in prevention of monkeypox. The first vaccine for monkeypox was approved in September 2019. Research is also underway for the development of specific antiviral medications, again, for both smallpox and monkeypox. We don't have this for monkeypox yet, but research continues. All right, let's talk about surveillance. Surveillance for infectious diseases is critical for any country wanting to have a good prevention and control program. Countries at risk for monkeypox should include this disease in their integrated disease surveillance and response system. The goal, of course, is to detect and immediately respond to any suspected case of monkeypox. It's important for the national program to develop case definition. We can also have definitions for a suspected case, a probable case, or a laboratory confirmed case. Initially, WHO can offer definitions, but it's up to the country to develop the one that's most appropriate for your circumstances. An example could be an acute illness with fever over 38 degrees, intense headache, swollen lymph nodes, back pain, muscle aches, and intense weakness, followed 1 to 3 days later by progressively developing rash, often beginning on the face where it's most dense, and then spreading elsewhere on the body, including the soles of the feet and palms of the hand. When a suspected case of monkeypox is found, it is really important to safely collect all the details on the person who has the infection, and to collect specimens from the rash lesions for every suspected case, according to the laboratory testing guidelines you've just heard about. Because monkeypox can be transmitted from person to person, it's critical that each case of suspected monkeypox be considered as a possible outbreak. It requires an immediate response. Report all case information to health authorities, and the national health authorities must rapidly initiate outbreak coordination and response mechanisms. These can extend to the regional and local levels. It's essential to put in place contact tracing and management immediately, active search for more cases, tracking of rumors, and enhancement of surveillance. Likewise, communities will need to have the right information and the key messages. Risk communication becomes very important in these circumstances. And remember, infection prevention and control at home and in the health facility are essential in all situations. Raising awareness of the risks that monkeypox presents is an important part of outbreak response as well as a component of monkeypox prevention. We want to prevent the arrival of new cases, whether they are from contact with animals or from contact with patients who are already experiencing monkeypox illness. Health education messages during an outbreak should be focused on helping people to protect themselves. For example, wearing gloves and other protective clothing for handling patients or indeed for handling animals that may be infected. Avoiding close contact with patients that may have monkeypox, whether at home or in a health facility. As we've heard, monkeypox is considered to be a re-emerging infection. It has been known for many decades, but in fact, we have seen the emergence of new cases and outbreaks in the last few years in a way that hasn't been seen in a very long time. WHO and partners are working to improve the understanding of this re-emergence of monkeypox and develop prevention and control strategies. Critical to this is the One Health approach because it is a zoonosis and infection is passed from animals to humans and then person to person. A One Health approach becomes an essential strategy. The World Health Organization is supporting countries to develop better capacity for disease control and supporting the further development of public health countermeasures such as vaccines and specific treatments. So let's recap. Monkeypox is a re-emerging disease. We now have all the information we need to identify monkeypox and diagnose it, whether it be in endemic countries or indeed anywhere else. Please do report any case of monkeypox to the World Health Organization and be aware of all precautions necessary to prevent further spread of this really unpleasant disease. This concludes the introductory course on monkeypox prevention and control. Please join us soon for the intermediate course. And if you have any questions or comments, join us on the discussion forum on OpenWHO.